Kashmir University of Agriculture Sciences and Technology, Jammu Kashmir. So he'll be speaking on zoonosis, present status and the strategies. And another speaker from ICMR, Dr. Ajit Dadaji Shewari, is Assistant Director, NCDC, the Directorate General of the Health Services, Minister of Health and Family Welfare, New Delhi. So these two the speakers will contribute their expertise and their own experiences with you all. I request our organizing secretary, Dr. Rajeshri Madam, to introduce the first speaker, Dr. M.A. Malik sir.
Thank you, sir. Very good morning to all. It's my pleasure to introduce today's speaker, Dr. M.A. Malik, Professor and Head, Veterinary Public Health and Epidemiology Department, Sher-e-Kashmir University of Agriculture and Science and Technology of Jammu. Dr. Malik has completed his BVSc in 1986 from Mumbai Veterinary College, Mumbai. MUSc in Veterinary Public Health and Epidemiology in the year 1997 from Punjab Agriculture University, Ludhiana, Punjab. He has completed his PhD in Veterinary Public Health in the year 2013 from Sher-e-Kashmir University of Agriculture Science and Technology, Jammu. He has joined the Department of Animal Husbandry, Government of Jammu and Kashmir in June 1987 and worked as veterinary assistant surgeon there for more than 14 years. In 2002, he joined as assistant professor in the Division of Veterinary Public Health and Epidemiology, Sher-e-Kashmir University of Agricultural Science and Technology of Jammu. He has been heading the Division of Veterinary Public Health and Epidemiology from 2011 to 14 and again from 2018 till date. He has been guided 11 PhD and MUSc student as a major guide, and he has been a part of research project in 6 externally funded projects. And he has been having a contribution, or he has published more than 130 publications in articles in reputed journals. He has been working as a nodal officer since 2013 for online examination being conducted by ASRB at FVSC and AHRL Pura, Jammu, under the project entitled Developing, Commissioning, Operating and Managing an Online System for NET and ARS Prelim Examination in ASRB ICAR. He has been a part of team that conducted the first online examination for NET ARS Prelim in March 2014. So with such a vast background and subject knowledge, we welcome today's speaker, Dr. M.A. Malik sir, and invite for delivering the speech on zoonosis, present status and strategies.
Thank you, ma'am. Thank you.
Yes.
डॉक्टर साहब शेयर आप करेंगे यहाँ से करेंगे?
नहीं सर, आप ही करिए उधर से.
ठीक.
If some problem, then they will share.
हाँ किया था. हाँ. Yes. Yes. अभी सर स्लाइड दिख रहा है?
दिख रहा है?
आप जूम कर लिए उसको.
ठीक है.
Yes.
Am I audible?
Yes, sir. Yes.
Okay. Good morning. Good morning, everyone. Good morning, organizers, senior faculty members, and their students. So today I'm going to talk on zoonosis, prevalence status, and strategies. Now, as I am told that there are some students also, some faculty member also. So we have prepared accordingly. So WHO defines zoonosis as diseases and infections that are naturally transmitted between vertebrate animals and humans. A zoonotic agent can be bacteria, fungus, virus, or other communicable agent. As we know, at least 61% of all human pathogens are zoonotic and have represented 75% of all emerging pathogens during the past decade. Now, as we know, more than 70% of our population is in rural areas. So about 80% of the population is always under threat of acquiring certain zoonotic diseases. Now, respected participants, I will come on later on this strategy for the rural people. What should be the strategy for the rural people to make them aware regarding zoonosis? But these are the persons who are always the bear the brunt of these zoonotic diseases because of lack of knowledge or facilities. Zoonoses are no longer a national problem since their effect on global economy and health. It is very well known that now, due to the shortening of the distances and rapid travel, these diseases communicate or they are spread very rapidly. Due to economic liberalization and globalization, livestock sector has to face challenges on various fronts. Naturally, whenever there is development, something we have to pay a price of that thing. So that's what is happening regarding the spread of zoonosis. But we have to mitigate this. Now, what is the significance of zoonosis? Now, uh, now in India, there are so many cases of simple. I will talk about diarrhea, treatment of sick people, and medical costs. Now, simple diarrhea. What happens? We in our day-to-day, a person is having diarrhea, he will take medicine or this and that and stay at home. But sometimes they need the hospitalization. The cost is there is so much of cost involved in that when a person is admitted in the hospital, suppose for 5 days, 5 days he will spend on medicine, he will lose mandate. So there is economic loss. Drains on national exchequer by way of imports of livestock products and ban on exports. So if we are not following the proper protocols, our exports will be hampered, and will have to spend more for the import of the livestock products. Now, the expenses on surveillance mechanism, e.g., diagnosis of animal disease, detection of disease reservoir, quarantine, inspection of foods of livestock origin, and so on. It all makes some burden on the economy of the country. Now, emerging and re-emerging diseases. An emerging disease is defined as a new infection resulting from the evaluation or change of an existing pathogen, or parasite resulting in a change of host change, vector pathogenicity or strain, or the occurrence previously unrecognized infections or diseases. For example, avian influenza, bovine spongiform, and the Nipah virus. Now, there are constantly the pathogen is going, some changes are going on in the pathogen, maybe due to the environment or maybe to his mutations. So newer and newer diseases are emerging. Now, a re-emerging disease is considered an already known disease that either shifts its geographical setting or expands its host chain or significantly increases its prevalence. For example, brucellosis. Now, brucellosis is a classical example of, I will say, a re-emerging disease. If we go back to the literature for the last 10 or 15 years, now the incidence of this disease has increased. Maybe intensive cattle farming or whatever the reason, but this disease is re-emerging in the parts where there was previously it was not there. Now the reverse zoonosis. Now man is also responsible for transmitting disease to the animals. So that is reverse zoonosis. For example, during the pandemic of 2009 H1N1, the novel virus was able to travel across the globe and from human to swine in less than 2 months. Now, these are the zoonoses. We all know these are the zoonotic diseases, and this is they have got a great burden on us. But what we are doing and why are these happening? So there are certain factors which are influencing the prevalence emergence of zoonosis. For example, ecological changes in man's environment. Now, the forest area is shrinking, and the man is encroaching upon the lands of animals. Thereby, it is coming in contact with the animals more frequently.
Sir,
Thereby,
sorry to interrupt you. Your screen is not sharing, sir.
pardon?
Screen share. Please.
It is not sharing.
No, not sharing, sir. आप PPT पहले सर ओपन कर लीजिए. Then you share the screen.
I had opened that.
ओपन था सर, वो बीच में वो फिर वो होम पे गया, होम पेज पे, then it disappeared.
Okay. Let me see.
सर मैं यहाँ से शेयर करूँ?
हाँ, ओके, आप वहां से कीजिए.
ठीक है, यहाँ से शेयर करना. Hello. Sir, now you can see the slides.
So, slide number.
Slide share किया sir.
Yeah, this slide number 7.
बराबर है? Slide number. Go down.
वही शेयर कर रहे हैं.
हाँ, इसको यहाँ से करो ना.
ठीक है सर, बराबर है?
यहाँ से करो. ठीक है.
यहाँ से. Now, अब दिख रही है स्क्रीन आपको?
हाँ, दिख रही है सर.
You are able? Okay.
दिख रही है? हेलो.
ठीक है. Shall I start?
हाँ. Emerging diseases है. बराबर है slide?
हाँ, बराबर है.
आप बोल दीजिए आगे करना है तो we can go for the next slide. ठीक है?
Okay.
ठीक है सर. You can continue.
Thank you. Now, the factor influencing the prevalence and emergence of zoonosis. Now, increased movement of man. As we know, now the traveling has become so easy. There are so many domestic airlines and the subsidy they are providing, and the travel has become so fast, and this just has become a global village. So increased movement of man is also contributing towards the spread of the diseases. Increased density of human population, then fluctuation in animal populations, anthropological customs and food habits, then handling of animal byproducts and waste, increased trade in animal products. So these are all things which are happening around for the industrialization or through the travel. They're all contributing towards the increasing or putting some pressure on this environment, and the diseases they are emerging in the newer areas. Next, please. Now, common emerging diseases in South Asia. WHO FOI identified diseases and agents relevant to Southeast Asia. These include avian influenza, rabies, Japanese encephalitis, leptospirosis, hantavirus, SARS, Nipah virus, cysticercosis, echinococcus, and schistosomiasis. In addition, plague and anthrax are also considered important in India. In addition, diseases like tuberculosis, brucellosis, and salmonellosis and other foodborne illnesses continue to draw attention of the epidemiologists. So these are important diseases in the South Asia for particularly this rabies and Japanese encephalitis, tuberculosis and brucellosis. Now, according to WHO, of the total global cases of tuberculosis, about 30% reside in India. This disease cost India rupees 13,000 crore per year, and the number of people dying of the disease in the country is 37,000 per year. That is over 1,000 deaths per day. And the women and the children are the major sufferers of this disease. Now, the zoonotic angle of Mycobacterium bovis, which could also circulate in a human-to-human cycle, and that too in a more devastating manner than M. tuberculosis, needs to be probed and further studies so that the strategies can be devised to control this dreaded disease. Now, coming to the brucellosis. Now, I would say from the experience of my experience from the field and in the university, the brucellosis is a major disease which is causing economic loss to the farmers. And of course, it has got public health significance also. But this disease, when once it enters the herd, it is very difficult to eradicate disease. Brucellosis is rampant in the bovine population of the country. Some of the organized farms showing a prevalence of 20% or more. As earlier I told that if we go back 10 to 15 years, the incidence was less or the prevalence of brucellosis was less. But now it has increased, maybe due to our intensive cattle farming system. This disease has increased. Further, I will tell one thing, the control of brucellosis is a challenge to the veterinarian. I should say it's a challenge in the sense in the foreign, if we go to the literature, they write, okay, depopulation, test and slaughter, and this and that. But in our country, we can't go for test and slaughter. We can't go for depopulation. So we have to control this disease through vaccination and through awareness programs. The mass-scale vaccination animal has not been regulated practice in the country except in some farms. So vaccination, we are also lagging behind in this vaccination against this disease. Human infection most often is associated with Brucella maritans. As we know, it is the most pathogenic of the Brucella. Brucellosis, it also affects the small ruminants. Brucellosis in sheep and goat causes infection with bacteria of the genus Brucella, and it is characterized by abortion in late pregnancy and subsequent high rate of infertility. The disease is zoonotic and occupational, causing undulant or Malta fever in man. So, serological evidence are suggestive of high endemicity of brucellosis in India, with national average of as high as 5% in cattle, 3% in buffalo, 7.9% in sheep, and 2.2% in goats. So why brucellosis is so important? Because in the last trimester, it causes abortion in the large animal. So what happens? One whole lactation of the animal is lost. That is 305 days lactation. If on an average an animal is producing 10 liters per day, so there will be loss of 3,000 liter milk. And if 3,000 multiplied by 50, so the loss for the farmer becomes enormous. And moreover, the risk to other animals that is there. Now, in small animal, it causes abortion epididymis in sheep, abortion arthritis, spondylitis, mastitis, etc. Now, disease in human. Brucella maritans infection causes undulant or Malta fever in man, which is characterized by intermittent fever, malaise, fatigue, night sweats, muscle and joint pain. Whereas Brucella abortus causes a milder disease. Osteomyelitis is a common complication in human brucellosis. So the brucellosis is very significant from public health point of view also. Somewhere I have read in literature that it has been transmitted through the coitus in human. Now the rabies. Rabies is, as we know, it is 100% fatal but preventable disease. Now we say there are annually around 20,000 deaths in India. but still this disease is there, and the efforts, no doubt, they are bearing fruits, but still a lot of work has to be done. Here we conducted a small study regarding awareness of rabies among the rural population. It was very less. The people, the basic thing that what should they do after a dog bite? If the people are made aware of this, that after a dog bite, immediately you wash the wound and apply some antiseptic and report to the nearest health center. The rabies being symptomatic or being infection occurring in a human being can be prevented to a larger extent. So for this matter, we have to go a long way to make the public aware regarding rabies. Japanese encephalitis. This is one of the dreaded disease. Japanese encephalitis is endemic in India and many countries of Asia, including China and Japan. The total number of cases reported in Asia is placed between 30,000 to 50,000 per year. The disease first appeared in India in 1955 and the first outbreak occurred in 1973 in West Bengal. It was only after 1978 that the disease became widespread. As many as 1,745 cases were reported from Gorakhpur alone during 2008 with 136 deaths. So in UP, we often see the outbreaks of this disease, occurrence of Japanese encephalitis. Now there are other diseases also like SARS, Nipah virus, plague, and anthrax. The first confirmed case of SARS was a 32-year-old marine engineer who had sailed from Hong Kong and reached Goa on April 1, 2003. Prompt diagnosis by National Institute of Virology, Pune, and medical care prevented further spread of the disease in the country. So it was good work done by National Institute of Virology, Pune. Strict surveillance at the international airport and seaports, particularly on travelers from China, Singapore, and Hong Kong, was enforced. The WHO has since declared India free of the disease. Now the anthrax. Now I have included some diseases which are more prevalent in small ruminants. For example, anthrax. Now anthrax in sheep and goat. How it is transmitted through eating, breathing anthrax spores. Transmission in humans, handling of infected animal carcasses and products, breathing anthrax spores, and are eating undercooked contaminated meat from infected animals. Now, the symptoms of anthrax in animals are fever, lack of rumination, excitement followed by depression, difficult breathing, uncoordinated movements, convulsions, bleeding discharges from the nose, mouth, rectum, etc. Now, in human, it has got three forms: cutaneous, gastrointestinal, and respiratory form. Cutaneous form is a sore on the skin which develops into a painless ulcer with a black center, blackish char. Now the gastrointestinal form: fever, nausea, bloody diarrhea, loss of appetite, and stomach pain. On the respiratory form: throat, itches, coughing, tiredness, and shortness of breath. As we all know, the anthrax can be used as a bioweapon in biological terrorism. Now the Toxoplasma gondii, this is also one of the disease of sheep and goat. So they get infected from eating or drinking contaminated feed and water. Now the human also get infected by eating or drinking contaminated milk, water, and contaminated meat, contact with water, fetuses, and placenta, soil, and dust. Now other important diseases: Q fever, Coxiella burnetii. We know a lot of work is being done on this disease, and the incidence of the disease is quite high. Now, the strategies for control of zoonosis. Now, as we all know, there are zoonotic diseases. Now, a lot of universities, a lot of scientists, they are working on zoonotic diseases, and they are well established. For example, in Jammu, Brucellosis disease, cysticercus, then scrub typhus. These all diseases, they are established, they are there in this area. Now, what can we do to prevent these diseases or to prevent the population from being infected with diseases? Now, the diseases are there, but now we have to devise the strategies to control these diseases. The control and prevention of zoonotic diseases remain primary concern in a country like India, where human and animal population are huge and interaction between the two are intimate. So there is a large human population and large animal population, and there are also usually they are coming in contact with each other. So there are chances of diseases occurring. Now WHO framed a strategic framework in 2007, wherein it said there should be risk reduction, establishment of coordinating mechanisms, strengthening surveillance response, preparedness, capacity building, and promotion of integrated multidisciplinary approach to research. Now, some of the major areas that require the focus are legislation and public education. Analysis of socio-economic impact of zoonosis, control and prevention of zoonosis in animals, including vector control. Then identification of priority zoonosis for appraisal of their risk factors, cooperation between veterinary and public health authorities, identification of existing and future challenges in the management of zoonosis. Now, strategy towards transboundary surveillance. Now, as I'm a man of, I cannot say I am a man of, but my specialization is veterinary public health. Now, very easily we say that this withdrawal period of antibiotic is 72 hours. So what should the farmer do for 72 hours? If he administers antibiotic to his animal and he is not able to sell the milk, suppose strictly following, it should be the 72 hours withdrawal period should be given, so that the consumer gets the drug residue free product. Now, what will happen to the farmer if he has to waste his 3 days milk production? Is there any legislation or any government has to take some responsibility to compensate the farmers for his loss? So it's very difficult. So we have to go for some legislation so that wherein we can compensate in a way to the farmer, so that he is readily tell or he admit that he has given the antibiotic and he cannot sell the milk for so many hours. But if he gets some compensation, otherwise he will never tell if he has administered any drug or that. Disease surveillance system. Using new approaches and tools like syndromic surveillance, geographic information system, remote sensing, molecular epidemiology, information technology, bioinformatics, economics, and sociology. Now, the syndromic surveillance is the wherein the health indicator of the human we can also take into consideration while conducting the surveillance of disease. To develop a forewarning system to facilitate timely interventions, particularly relevant in case of vector-borne diseases, which show prevalence to the specific seasons or weather condition. For example, nowadays, there are so many cases of dengue fever. So we can say when the mosquito will be there, there are chances of the dengue fever. So accordingly, we can devise our strategies for the control of this disease. Now, networking of labs. A close networking between veterinary and medical laboratories and professionals at different levels needs to be developed. The professionals must become part of rapid response teams to investigate epidemics. Each district and state in the country needs to be linked through satellite to a designated national headquarters for collecting real-time data on the activity of pathogens and diseases. Efficiency in surveillance work is the key to the success. So, surveillance, first we have to network the labs, and the professionally also we have to connect to each other so that we can perform the surveillance in a better way. If the surveillance is good, there are chances we can prevent the disease from occurring. Now, establishment of area-specific diagnostic laboratory. During epidemics of disease, information collected must be processed and forwarded to appropriate authorities in the shortest possible time. Laboratories network to facilitate movement of information, Even smaller diagnostic units may also be provided with modern equipment for rapid diagnosis. Facilities for molecular diagnosis are essential. Now, coming to these smaller diagnostic units, as we know, I have also worked for 6 months in the rural area of Maharashtra as internee. So when we went for some outbreak, so we didn't have anything to conduct the diagnosis or carry out the diagnosis. So if we can have some smaller units nowadays, so that even if we move to the rural areas or interior of any state, we may at least try to diagnose the disease there and then only. Now the National Center for Disease Control. National Center for Disease Control is an institute under the Indian Director General of Health Ministry of Health and Family Welfare. It was established in July 1963 for research in epidemiology and control of communicable diseases. Now, what is the human component in this? This is a training of health professionals, implementing use of intradermal route of inoculation of cell culture vaccines, strengthening surveillance human rabies, information, education and communication, laboratory strengthening. Now, what is the animal component with the NCDC? This is mainly on rabies, is this population survey of dogs, mass vaccination of dogs, dog population management, strengthening surveillance. Now the global level, global early warning system for major animal disease, including zoonosis. The joint FOI global early warning system for health threats and emerging risks. The ultimate goal of GLUE is to inform prevention and control measures through the rapid detection and risk assessment of health threats and events of potential concern at the human-animal ecosystem interface. Now, what are the actions of what is GLUE supposed to do? Tracking of zoonotic disease outbreaks that merit further validation. Sources of information can be official or unofficial from the global human and veterinary public health communities. Information sharing and validation is performed through the appropriate organizations. GLUE links with the International Food Safety Authorities Network to ensure that food safety events are managed along the farm to table continuum. Now, the multidisciplinary risk assessment provides added value to the global early warning of zoonotic diseases. What it says, GLUE, a world capable of preventing, detecting, containing, eliminating, and responding to animal and public health risks attributable to zoonosis and animal disease with an impact on food security through multi-sectoral cooperation and strong partnerships. Now, this is I have put up some slides for the students. Food and Agriculture Organization, based in Rome and established in 1945. Now, objectives: help eliminate hunger, food insecurity and malnutrition, make agriculture, forestry and fisheries more productive and sustainable, reduce rural poverty, enable inclusive and efficient agricultural and food systems, increase the resilience of livelihood to threats and crises. The World Health Organization, the World Organization for Animal Health, or OE. The World Organization for Animal Health is an intergovernmental organization coordinating, supporting, and promoting animal disease control. It's based in Paris, France, and has 182 members, founded in 1924. Now, what are the objectives of OI? Transparency, ensure transparency in the global animal disease situation, scientific information, to collect, analyze, and disseminate veterinary scientific information, encourage international solidarity in the control of animal disease, which is very important, safeguard world trade by publishing health standards for international trade in animal and animal products, improve the legal framework and resource of national veterinary services, to provide a better guarantee of food of animal origin, and to promote animal welfare through a science-based approach. Now, if we have better food of animal origin, naturally, a country like ours, we can have good amount of exports. Now, WHO, the World Health Organization, is a specialized agency of the United Nations that is concerned with international public health. It was established in 7th April 1940 2008 and is headquartered in Geneva, Switzerland. The WHO is directing and coordinating authority on international health within the United Nations system. Now, what the World Health Organization is doing, it is providing leadership on matters critical to health and engaging in partnership where joint action is needed, shaping the research agenda and stimulating the generation, translation, and dissemination of valuable knowledge, setting norms and standards and promoting and monitoring their implementation, articulating ethical and evidence-based policy options, providing technical support, catalyzing change, and building sustainable institution capacity, and monitoring the health and situation and assessing the health trends. Now, this is the main job chart of the WHO. Now, these were some of the strategies which national or international level which are going on. They are working for the control of animal diseases and for zoonotic diseases. Now the One Health concept. Nowadays, the One Health, there is so much of work is being done. Government has sanctioned so many projects on One Health. So what is One Health? There is understanding that animal health, human health, and ecosystem health are interlinked, and integration of these disciplines is necessary for future research and development. So in epidemiology, we say environment is always very important, because if we go back in America, they were able to control contagious bovine pneumonia even before isolating the Mycoplasma mycoides. So before the causative agent was known, they had controlled the disease. So ecosystem or ecological factors, they are very important for the occurrence of disease, and their study is very important for the control of the disease. Now, what is One Health? It is to denote the collaborative efforts of many disciplines working locally, nationally, and globally to attain optimum health of human beings, animals, and our environment. The Manhattan Principles on One World, One Health mention that a broader understanding of health and disease demands a unity of approach achievable only through a consilience of human, domestic animals, and wildlife health. So this is One Health, where the health of animal, health of human, and health of our environment is in. Now, what is the timeline of how the One Health got developed? In 1820, Rudolf Virchow, he said, no divide between human and animal medicine, and he coined the term zoonosis. Then came William Osler, a Canadian physician. He said there are relations of animals to man in form of diseases. James Harlan Steele was an American veterinarian recognized as the father of veterinary public health, who led some of the first efforts to prevent the spread of disease from animals to human beings. Then came Calvin Schwabe, who coined the term One Medicine. The Wildlife Conservation Society in 2014, in the Manhattan Principle, where the One World, One Health was echoed, lists 12 recommendations for establishing a more holistic approach to preventing epidemic, epizootic diseases, and for maintaining ecosystem integrity for the benefit of humans, their domestic animals, and the foundational biodiversity that supports us all. Now, in 2005, implementation of Asia Pacific Strategy for Emerging Diseases, and in 2006, development of beliefs on major animal diseases. So this is how we have evolved to One Health. In 2007, One Health Initiative Task Force formed by American Veterinary Medicine Association. The One Health Initiative Task Force was formed in 2007. And in 2008, World Bank, World Health Organization, FAO, United Nations Children Fund, United Nations System of Influenza Coordination, World Organization for Animal Health. What they did, they had a framework. The objective of the framework was to establish how best to diminish the risk and minimize the global impact of epidemics and pandemics by enhancing disease intelligence, surveillance, and emergency response systems at national, regional, and international level. In 2009, establishment of One Health Commission. In 2010, 10 tripartite concept strategy and FAO WHO collaboration to address health risks at the animal-human ecosystem interface. And in 2011, first International One Health Congress was held at Melbourne, Australia. 2016 One Health Day is celebrated. It started celebrating on 3rd of November. Now this is how the One Health has evolved. And now for human health, we say there should be human, animal, and environment. They all three should be healthy for the One Health for human health. Animals serve as a reservoir of many zoonotic pathogens for human beings. Prevention and control of most of these pathogens involve collaborative efforts among medical, veterinary, and eco-health specialists. Now, neglected zoonotic diseases are the diseases that affect poor people in the resource-poor countries. Now, see the three diseases which are very important. I would say Echinococcus, Brucellosis, and Rabies. Now, Brucellosis, around 212 million are lost every year due to Echinococcus in India, and due to Brucellosis, the livestock sector suffers a loss of around 3.4 billion US dollars every year. And due to rabies, there are around 20,000 deaths in India. So these are neglected zoonotic diseases, but their impact is very heavy. Now, as I earlier said, these are three classical zoonotic diseases, which we have to take care immediately because they have got significant economic effect on the economy of the farmer. That is negative effect. It decreases the economy of affects the economy of the farmer. Now, in food safety, there are more than 250 agents, including a variety of bacteria, virus, parasites, and chemicals that may contaminate food and cause foodborne illness. Most of the foodborne illnesses are zoonotic. The advent of modern food processing technology also concerns the area of food safety. The widespread use of refrigerated, ready-to-eat food cast doubt on the food safety, especially in reference to psychophilic pathogens. So, as I earlier said, whenever there is technology, there comes something which has got some negative impact also. We have to take care of that negative impact so that the technology which we have developed that can flourish. Now, antimicrobial resistance. Human, animals, and environment have been associated with the development of antimicrobial resistance in the microorganisms. Several factors are responsible for the increasing problem of antimicrobial resistance. Sale of antibiotic without prescription, over-prescription of antibiotics, inefficient patients' compliance, lack of control policies for infectious diseases and human behavior. So they all contribute toward the antimicrobial resistance. Many pathogens, now new and emerging infectious diseases, many pathogens originate in wildlife and create havoc in the human population. For example, novel SARS-CoV-2 is the recent example, and how a pathogen believed to originated from wildlife has threatened the entire human life. So, what has happened to the whole world after this? Combined strategies and joint efforts involving scientific community across the discipline are essential to mitigate the challenges of disease emergence before they enter human population. Now, the use of One Health. There can be successful use of One Health team to solve problems emanating at the human-animal environment interface across the globe. COVID-19 response in India is one of the best examples of the utility of One Health teams in resource-limited countries. So the veterinary also has contributed towards mitigating the effects of COVID-19 during the recent outbreaks. Now, Paracelsus, a Swiss physician, has said, once a disease has entered the body, all parts which are healthy must fight it, not one alone, but all. Because a disease might mean their common death. Nature knows this, and nature attacks the disease with whatever help she can muster. Now, this was I just wanted to share my experience. Now, there are diseases, there are remedies, there are literature, there is everything. Diseases are established, their mode of transmission is established, their effects are established. Now, how we make our farmers aware of this so that he can take appropriate measures at his own level. For example, I will tell experience from my own state. There are certain tribes, what are they doing? They make a kacha house, and along with animals, they live in that particular big room. So animals are there, human is there. So there is expired air of the animals. So which slowly and slowly weakens the lungs of that particular family members, and they are prone to the tuberculosis. So this is in the rural area. So in that particular bed, the number of tuberculosis patient is much higher as compared to the other area. Now, what is the best way? How can we make our rural population aware regarding zoonosis and the control of these diseases? Now we say there is technology, there is internet, there are apps, and there is everything. But if we see this particular slide, I have just put in to show the difference between the rural and urban access to internets in India. So what we have to do, I think the mass contact program with the farmer is a better option to make them aware regarding the zoonosis and the control of these diseases. Thank you very much for giving me patient hearing. Hello.
For giving a detailed insight for zoonosis, its present status and strategies. So I think this topic has been covered very well, including all the zoonotic important diseases and the strategies for prevention and control. So if participants have any questions, we can ask. Sir, there is one question. Is brucellosis vaccination is necessary in those areas, especially in hill areas where it was not endemic?
Where it is not endemic.
Yeah.
But still the movement of the animal is there. So for brucellosis, if it is not endemic, it's costly. Maybe it has got economic burden, but vaccination is the only way out to control the brucellosis. Otherwise, there is no way out.
Okay. Okay.
And ma'am, so if you go back to the literature, the incidence of brucellosis is increasing. It is not decreasing, it is increasing day by day.
So it is better to get vaccinated
to
be on safer side.
To be on a safer side.
Yeah.
Because it causes huge economic loss.
Yeah. Otherwise, also this vaccination is been advised in only cow food, those female cows only.
Yeah.
So I think it is better. So any more questions from participants, please? I think, sir, you have covered in detail all the aspects of this zoonosis. So I think there are no more questions. So we are very much thankful, sir, for you for delivering such an important speech. So thank you so much, sir.
My pleasure, ma'am. My pleasure.
Okay. Thank you, sir. Thank you so much.
Thank you. My pleasure, sir.
Sir, have you sent that, I think 3-4 pages write-up?
Okay.
We are publishing a souvenir.
Okay.
And compendium for this training program.
Okay.
So on topic you just send me 3 to 4 pages write up.
Okay.
So that we'll be able to publish that. Okay,
Okay, that's okay.
and all
Definitely.
other details you have sent it.
Okay, okay. I will send everything. Whatever you have asked in the mail, I will send everything.
Yeah. Okay, okay, sir. Thank you. Thank you so much, sir.
Okay, that's have a great day.
Thank you. Thank you. तरी सांगितलं. Hello. Now we will come to the next topic. That is Dr. Ajit Dadaji Shevale. He will be covering the topic on One Health initiatives in the human health sector for disease control. Just now he has called me. He's having some internet connectivity problem there. So just wait for 5 minutes. So within 5 minutes he will be joining. By the time I will ask.
Good afternoon, sir. I can see now.
Yeah. Okay, you have joined?
Yeah.
Yes, thank
sir.
you. Thank you. Yeah. Welcome, Dr. Shevare. And initiatives in the human health sector for the disease control. Now I will ask my colleague, Dr. Rajeshri Patil Madam, to read his biography to introduce to all the participants. Madam, please.
Thank you, Jende sir. Now, second speaker of today's certificate course, Dr. Ajit Shevare, who is working as a Deputy Director, National Center for Disease Control, New Delhi, Ministry of Health and Family Welfare, Government of India. Dr. Ajit Shevare has completed his graduation from NGM Medical College, Kamote, Navi Mumbai. He has also completed his diploma in Human Resource Management from Wellinger Institute of Management. He has completed his Doctor of Medicine degree in Community Medicine from SAIT GS Medical College and KM Hospital, Mumbai. He has been also completed and passed the National Board of Examination DMB, Social and Preventive Medicine. And he started working as a resident medical officer in KM Hospital. Later on, he has been worked as an assistant medical officer, Public Health Department, Mumbai. He is also worked as an assistant professor in PJ Medical College, Pune from January 2013 for 7 months. He has also worked as a surveillance medical officer under World Health Organization from 2013 to 14. He has also worked as a zonal adverse event following immunization consultant, National FE surveillance program. He has been also worked as a manager FE from 2016 to 17, and he is worked as an assistant director after joining in National Center for Disease Control from 2017 to 19, and from 2019 till present he is working as a as a deputy director at National Center for Disease Control, New Delhi. He has 11 years of demonstrated experience in working government, non-government sectors at community level and policy level. He has been an expert and trained epidemiologist, and he is passionate for bringing about change in lives of community through community-driven public health programs His areas of interest and extensive experience is in epidemiology, vaccinology, vaccine safety, and vaccine pharmacovigilance, zoonotic diseases, biostatistics, medical research, etc. His core competence lies in conceptualization, strategies, evidence-based planning programs, and project management. Developing and delivering training packages or programs, and writing technical proposals and project reports. He has a strong leadership skills, interpersonal, strategic, and managemental skills. He has extensive experience in working with senior management at various many medical organizations. So, with this background, now I welcome Dr. Ajit Sheware and request him to deliver his speech on One Health initiatives in human health sector for disease control. Dr. Ajit Sheware, please. Sir, can you do that slideshow, please? Sir, we can't hear. Please unmute.
Hello. Please unmute yourself. Dr. Saab. Hello. Hello. Please unmute yourself.
Sir, can I? Are you able to hear me?
Yes.
So
Now,
I'm trying.
also requested to just zoom your slide. Slideshow. In presentation mode, you can just put
presentation.
not it is not
Yeah. So thank you, madam and sir, both for inviting us for this 4-week course, and I think the audiences are well versed in zoonosis, and this will be an opportunity for me to sensitize the about the initiatives we are undertaken on, which are being undertaken.
Hello. So you're not audible. Hello. Dr. Saab, you are not audible.
Okay, just wait.
Excuse me, sir. The slide is not in a presentation mode.
Yeah, I think. Hello. Dr. Saab, you can put your slides on presentation mode. And while using your microphone, please it should be near, because you're not audible properly.
Properly?
No.
Some issue.
And make it your slide in presentation mode.
Tell me whether it is in slide mode now.
No. Yeah, now it is. And if there is some internet connectivity problem, you can switch off your video, no issue. No, it is again gone back to, it's not on slideshow.
Now it is clear, sir?
Yeah, it is clear, but it is not, slides are not in, now it is in presentation mode. Okay. Yeah.
That issue, some.
Go ahead.
Maybe because of internet connectivity. So I was telling that since many stakeholders are there, which are opportunity for me to share with what are the activities which are we are undertaking under this program, Ministry of Health, and as well as to join us for this program, so that whatever activities you are undertaking, we can support you technically and other initiatives so that they can be implemented at the local level. So basically, One Health, we all know, it is a collaborative and multi-sectoral approach which involves not only the human health sector, but importantly, animal health sector and environmental health sector. So we all know that the diseases which are reported, almost 60% of infectious diseases and 75% of new emerging diseases, infectious diseases are zoonotic in origin. If you have seen the recent experiences of the Nipah, Zika, West Nile fever, and along with this COVID pandemic, which its origin also was thought to be in zoonotic origin. So what is important is that the next pandemic, which is most probably going to be a zoonotic in origin, and that is why we need to gear up with all the stakeholders through One Health approach and improve the sustainability of our systems through the involvement of this medical coordination between medical, veterinary, and wildlife sector. Obviously, this concept is not new. This is an old concept, One Health concept. It has been emphasized by everybody. I think in your previous presentations also it has been highlighted. There is no doubt among any of the stakeholders that this One Health approach is not important. And this is the only way by which we control the zoonotic diseases along with the AMR and food safety and climate change. So why for One Health attention? Basically for India, as we know, which is the country which is having one of the highest population along with the animal population. 75% of the population is still living, 60 to 75% is still living in the travel, huge market, wet market, and animal trade, along with the AMR issue. So that is why the One Health is important. Now I am coming to the out of those three parts, zoonotic diseases, AMR, and food safety and climate change. Talking about mainly about the zoonotic diseases. If you see the major zoonotic diseases, Anthrax, Brucellosis, this is about the human health I am telling. So because we are dealing with the human health sector, so it does not have only impact in terms of morbidity and mortality, but it has significant economic impact. See the direct cost is about because of these landscape changes, biodiversity, and climate change. So what we have seen in this almost 4 to 5 years is that this leptospirosis, although is commonly reported from the coastal areas like Maharashtra, Karnataka, Tamil Nadu, it is not. Is there some issue with my speaker, sir? Somebody is writing not audible. Am I audible, sir?
Hello, audible. You are audible.
Okay, so basically all the scrub typhus, Japanese encephalitis, and scrub typhus, these rickettsial diseases, along with the anthrax, brucellosis. Now, if you see brucellosis, scrub typhus, these are such diseases, and leptospirosis now also. It is being reported through all over the country. But there are some diseases like KFD, then you take about the anthrax, CCHF. These are located in particular region of our country, maybe due to the local epidemiological situations. So anthrax is reported from eastern part of the country, CCHF mainly from Gujarat and Rajasthan. So, but with the advancement of these medical facilities and diagnostics, change slide. So the diseases are being reported from all over the country. Now I will talk about wanted to give you the idea about what are the One Health mechanism which are currently active in our country. If you see there is a collaboration between the stakeholders of NCDC along with the Ministry of Health, which is working under the Ministry of Health, along with the Department of Animal Husbandry, which is now a separate ministry with the Ministry of Fisheries, then the Ministry of Agriculture. So we have the common platform called as Standing Committee on Zoonosis, where we interact with each other and regularly meet in different forums. There is also collaboration between ICMR and ICMR. There is a MOU for cooperation on the area of zoonosis and AMR. We all know there is a ICMR is setting the One Health Institute at Nagpur for as a separate center for excellence. Along with that, initiatives have also been taken by the Ministry of Science and Technology and other ministries. For the zoonosis, we have Standing Committee on Zoonosis at the national level, and at the state and district level, these committees have been established. I will give you a brief update.
Hello. Doctor, now you are not audible. Hello. 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 Dr. Saab, you are not audible.
Sir.
Hello. Hello.
Sir, am I audible now?
हाँ अभी audible है. Hello.
So this outbreak is reported. Continue with my slide, sir, if I am audible.
Yeah. You are now audible.
Okay, so the major outbreaks are reported.
नहीं अभी नहीं, खाली मेजर आउटब्रेक का आवाज आया, बाकी नहीं आया.
There is suddenly
थोड़ा सा आई थिंक नेटवर्क प्रॉब्लम है उधर.
Suddenly the internet has gone sector, animal sector, wildlife and environment sector, along with the Ministry of Agriculture. We are also coordinating with the Ministry of Home Affairs and Department of State, along with the National Disaster Management Authority. So Ministry of Health is implementing this National One Health Program for Prevention and Control of Zoonotic Diseases since 12th five-year plan, and the nodal agency is the National Center for Disease Control. Now what we want basically under this program is, sir, whenever there is any outbreak is reported, just take example of Nipah or routine outbreaks of like any scrub typhus, leptospirosis. Normally the medical and the rapid response team is there at the IDSP. They go and investigate the cases. So veterinary consultant is already there, a part of IDSP, rapid response team at the district and state level. But what we want under this program is that there should be an institutionalized mechanism. That means there should be a regular communication and coordination, so that when any pandemic or any outbreak is reported, every system is prepared and both the sectors are aware about what is actually happening in the both animal sector and human sector. So that is why we want to institutionalize this mechanism, and this is our vision. So at block level, there should be a coordination between the medical officer as well as veterinary officer and the paravets and the our frontline health workers like ASHA and ANM. And the district level, there should be communication between the district surveillance officer and district veterinary officer, along with the representative from the wildlife and forest. And same at the state level. So at the regional level, so this is about at the district and state level, but at the regional level, you can see that at the regional level, we have regional coordinators for One Health. So we have strengthened few institutes, 6 medical institute and 4 veterinary institutes, which are coordinating the catalyzing this coordination between the medical and veterinary sector. So what basically we are undertaking is under this program is, we are institutionalizing One Health through these health committees, zoonotic committees, as well as through the regional coordinators, both medical and veterinary institutions. Capacity building. So we are giving grants to these regional coordinators, and they are undertaking both sensitization training as well as hands-on training for the microbiology professionals for diagnosing both medical and veterinary diseases. Since the surveillance, the communication part, basically we have the system called as IDSP for human health sector. For animal health sector, NADRS is there, but that system needs to be matured enough to gather the actual data. So what we are doing is that we are planning a communication platform. There is already an integrated health information portal, IHIP, if you are aware about. IDSP has moved to the IHIP, and in that platform, there is going to be an integrated data between both the animal sector and the human health sector, so that we can find out the what will be the early warning signals for the animal diseases. Along with that, we are going to reach out to the community through our massive IAC campaigns, so that the everybody and the target population like agricultural workers, animal handlers, farmers, they are aware about what needs to be done for prevention of these zoonotic diseases. So these are our new initiatives. Along with this formation of these zoonotic committees, we are going to establish the sentinel sites, which will be undertaking the dedicated surveillance for zoonotic diseases. We are planning to strengthen almost 80 to 100 medical colleges all over the country. This year, we have identified almost 20 medical colleges. With regards to aims, we are also strengthening almost 6 to 7 aims for these zoonotic diseases, which will be act as a center for excellence, and about the integrated surveillance platform. So this is our program progress. Almost 33 states, they have formed the State Zoonosis Committee. We have undertaken almost more than 10 to 12 trainings for both medical and veterinary professionals. Data sharing is already being undertaken with the help of Department of Animal Husbandry. And these 10 regional coordinators, they are expert in specific diseases, like NRC Equine is expert on glanders, Government Veterinary College Hebbal in the animal rabies, Nimans Bangalore is on the human rabies, while the other institutes like SMH Jaipur is for Zika. So we have labeled them as for specific zoonotic diseases, and they are coordinating with the respective state health authorities. So this is the network of the regional coordinator under the National One Health program. And these are the specific regional coordinators and their the states covered and major zoonotic diseases covered. So you can see that each regional coordinator is basically covering some 3 or 4 states, where they are coordinating with this medical and state animal husbandry department and state health department to institutionalize this committee and framing the state action plan on zoonotic diseases. So that is we are planning that next 1 year we will be planning a state action plan for each of these zoonotic diseases for each state. So this is about the status of reporting. We can see that the almost more than 32,000 samples have been tested by these sectors. Both these are the human tests which are performed by these our regional coordinators. Along with this, these are the animal sector. These are veterinary samples which are tested by these labs. So we are focusing both on the testing of both human samples as well as animal samples. And we want to avoid the duplication, and that's why we are also planning that some of the institutes like Animal Health Institute, which are active and expert, they can also undertake the human health samples. So this is the basically the formation of the committees. Few of the states, that Telangana and Himachal, they are remaining, but yesterday also we have received that Himachal Pradesh also has formed. So most of the states, they have formed the State Zoonosis Committee, and whoever today is listening to this presentation, and if he is a part of some state health department or state animal husbandry department, please get involved in this committee meetings and push the state for implementing the state action plan on zoonotic diseases. So at the ministry level, since each ministry is having a different priority, we are also planning a big One Health declaration with all these ministries, relevant ministries, so that everybody is committed to this One Health agenda. These are the few snapshot of the trainings and meetings which have been undertaken under this One Health program. So we have identified through the strategic application, we have identified 10 priority zoonotic diseases for human health sector in India, namely the human zoonotic influenza, followed by anthrax, Japanese encephalitis, leptospirosis, dengue, rabies, scrub typhus, and plague. So these are it. IEC material has been developed for these 7 priority zoonotic diseases. So basically our target population is the farmers, veterinarian, general population, agriculture workers. So for each of them, we have developed the billboards, pamphlets. These are the available on NCDC website along with the audio and video spots. Please, if you want to use, you can use it. These are freely available. Please download it and use for if you are undertaking any IEC activity in your area. So these were launched through our Honorable Health Minister on the 30th July 2021. So these are the few snapshot of this IEC materials which we have developed in last 1 year. So these are also the few manuals. There is Zoonotic Disease of Public Health Importance manual developed by NCDC. You can go along with the standing operating procedure, standard operating procedures. Basically, what needs to be done by the medical officer and veterinary officer in case of outbreaks. So those SOPs have been outlined. Now, along with this technical work or the work through the government health organization, what is important is the community should be involved. So how to involve this target population? So we are planning a big community outreach program through these organizations at the local level, through the Krishi Vikas Kendras, through RKVY and Panchayati Raj institutions. We are in discussion with the many agencies, either NGOs or the public health institutions or professional bodies. So we have received some proposals, and we are targeting some districts and states where we will be undertaking this community outreach program. So basically each farmer or animal handler will be able to know what needs to be done for brucellosis, what needs to be done for anthrax in case of cases anthrax is reported or any animal of his develops some symptoms. So those campaigns, dedicated campaigns with the key messages we are planning in this next 1 year. Now I would like to just highlight that what are the challenges we are facing in this whole program. Basically priorities are different. Now if you just, I want to give example for rabies program. Rabies causes significant mortality, almost 4,000 to 5,000 deaths in human health sector. But for animal sector, although it causes mortality of livestock, for them it is not a priority. They feel that like Department of Animal Husbandry, for them livestock is important. So we have to sensitize them about the importance in One Health. So that part can be addressed to advocacy. There is a limited coordination. So basically each organization has its own hierarchy. They work as per their culture. So what we want to have that improved coordination, and that we have addressed to the committees, zoonotic committees. In the biodiversity and challenging wildlife sector, India has significant part. If you see the KFD, occasional forest disease, it has been expanding from Karnataka, Kerala to now the parts of the Goa and some parts of Maharashtra. So what we what is important is that this biodiversity and the wildlife surveillance needs to be improved. We are working with the Wildlife Institute of India and some of the organization working in the wildlife sector to improve that part. Along with the political will, so we have already seen the joint importance of joint declaration and the limited data sharing. So although we are advocating with the Animal Husbandry Department for regular data sharing, now that will be coming, that will be soon be materialized, and we will get the exact data. So which data, suppose rabies is reported from which part of the country in animals, and at the same time what we are actually undertaking about the animal bites in that particular area. So that data sharing part is we are working upon. And low awareness among public, so that's why we are planning the community outreach activity. So these are the few challenges and how we are addressing it through this National One Health program for zoonotic diseases. See, these are the opportunities. Basically, at the sub-national level, we want to improve the laboratories. And I think with the COVID, that has become a very easy task because most of them are already undertaking those activities along with the data sharing and the piloting of this One Health project. So we want the agencies or the organizations or the institutions to come forward and show us the One Health model for zoonotic diseases so that we can actually collaborate them under the umbrella of this program. So this is all from my side. I think I would encourage all the participants uh, to look forward through the agenda of this One Health and do participate us under this program. If any support is needed from our side, please get back to us. Thank you.
Hello. Thank you so much, Dr. Shiva. Your comprehensive presentation on the One Health initiatives in the human health sector for the disease control and what are the programs are undertaken, and recently what you have also launched. That program also you have shown to all the participants, and the participant definitely they will take advantage of that, and directly or indirectly they can participate in this program which government of India has undertaken. I would invite one or two questions from the participant. Because I have seen in the chat box also there is no any questions available. So anyone? I think Dr. Shiva has already covered all the initiatives what the government of India is undertaking at national level, and the detailed he has covered all the programs. I think that could be the reason the people they are not having a question in their mind. So from my side, I will just put one question, rather clarification from my side that any programs, Dr. Shiva sir, uh, we can collaborate with the veterinary professions and is your medical side, because you know that you are also well versed with the One Health program what our government of India is undertaking and implementing in various states also. So wherein that the veterinaries also plays very important role. So that can be started within this financial year, so that our university side or any veterinary university they can collaborate that programs for better implementation in their respective states.
So thank you, sir. Basically, as I have already highlighted, we are already working with the veterinary universities. Few of the, I think I already highlighted in our presentation, and the veterinary colleges. We are also providing them funds as well as the technical supports. But there are obviously many universities and colleges who would like to work with us, and obviously we also would like to work with them um, under this National One Health program. So currently we are going to organize a community outreach activity, and I think veterinary colleges through the Krishi Vikas Kendras, I think they have good reach, so they can join us for that. If you need any invitation for proposals, I think please get back to us so that we can undertake the same. So those part is already available. About the strengthening the other institutes, we have already returned to the Department of Animal Husbandry and Ministry of Agriculture, Department of Animal Husbandry and Ministry of Fisheries to nominate such veterinary institutes. So they have also given us few names and we will be strengthening them. But if you want to reach individually, please reach out to us. Thank you, sir.
Thank you, sir. Sir, there is one question. Are there any association of... Hello? Sir, there is one question. Is there any association of NCDC with the state veterinary universities with respect to antimicrobial resistance?
I think AMR program is already working with the ICAR for those purpose, and AMR is also handled by the AMC, NCDC. Microbiology department in our NCDC looks after that. But if you need any association with the AMR program, do reach out to us. We will connect with the relevant authorities so that you can work in that area.
Okay, sir. Thank you, sir. Any other question? Any participant? Any other question? Anyone want to ask? So I think there are no questions. So
I hope I was
Dr.
audible,
Srivastava,
sir.
thank you so much for being a part of with us and sharing your own experience to all the participants. Thank you so much.
Sure. Thank you.
So thank you all the participants. Thank you to all the speakers. So tomorrow again we will start at 11 o'clock.